This is the anterior view of the larynx. The laryngeal skeleton consists of several cartilage structures, the largest of which is the thyroid cartilage. The thyroid cartilage is comprised of two rectangular lamina that are fused in the midline. Incomplete fusion of the two lamina superiorly forms laryngeal prominence, which is larger in males. The hyoid bone is found in yellow paper, and it sits by itself with no attachment. The hyoid bone provides attachment to the muscles of the floor of the mouth and the tongue above, the larynx below, and the epiglottis behind. When we swallow, the vertical displacement of the hyoid bone closes the epiglottis and larynx. The anterior displacement opens up the UES. The inferior horns of the thyroid cartilage form a synovial joint with the cricoid cartilage, seen here in blue. This ring-shaped cartilage is the only laryngeal cartilage to completely encircle the airway. It is larger on the posterior. The function of the cricoid cartilage is to provide attachment for the intrinsic muscles of the larynx, and it is involved in the opening and closing of the airway in speech production. The trachea can be seen here with these gray rings. If infiltrates enter the trachea, it can enter the lungs and you can get pneumonia. The trachea goes down and branches off into the right and left lung. It has C-shaped rings. If we go around to the posterior view of the larynx, the red structures here marked for are the arytenoid cartilages. The arytenoid cartilages are paired and pyramidal. They act as the attachment sites for the vocal ligament and the major intrinsic muscles of vocal fold movement. The movement of the arytenoid cartilages alter the size of the rima glottis, contributing to the abduction and adduction of the vocal processes. On top, you can see the corniculate cartilages in pink clay. There are two cone nodules which articulate with the top of the arytenoid cartilages and serve to prolong them. The epiglottis can be seen here in green paper. When the tongue base contracts and the larynx elevates, this causes the epiglottis to fall down over the laryngeal inlet, and sphincter closure closes off the laryngeal vestibule, so it moves down. It helps guard the laryngeal inlet from inadvertent entry of food or liquid into the respiratory tract during swallowing, so you do not aspirate and food does not enter the vallecula. Let's move on to the intrinsic laryngeal muscles. These muscles, besides the cricothyroid, are innervated by the recurrent laryngeal nerve branch of the vagus nerve, which is cranial nerve number 10. This includes the posterior and lateral cricoarytenoids and the interarytenoid and the thyroarytenoid muscles. The main abductor muscle of the larynx is the posterior cricoarytenoid, marked here, 7. This is a paired muscle, so when it pulls, it opens the folds. The posterior cricoarytenoid is the only abductor or opener of the vocal folds. The primary adductor or closing muscles of the larynx consist of the lateral cricoarytenoid, which is seen here. That's number 8. It adducts the vocal folds. It's the yellow paired ribbon. The thyroarytenoid, which is the black line here on the vocal fold, it inserts into the vocal processes, so during contraction the vocal folds are shortened and thickened. And finally, the interarytenoid, which are seen here in the blue and purple muscles marked 9. This is a non-paired muscle, consists of transverse and oblique fibers. Contraction of this muscle leads to arytenoid adduction and narrowing of the laryngeal inlet. It helps to adduct the vocal folds, seen inside here. Next, you have the vocalis, which is the blue line, seen here in the vocal fold. It shortens and tenses the vocal folds. In isolation, this action serves to lower the resonant frequency of the vocal cords. Finally, you have the paired cricothyroid muscle. Here, it is innervated by the external branch of the superior laryngeal nerve of the vagus, which is cranial nerve 10. You see it on both sides. If you tilt the thyroid cartilage forward and on the cricoid cartilage, thereby stretching the vocal cords and increasing the pitch of the voice. This action also results in vocal fold adduction, thanks to the cricothyroid muscle.